but that's why it's so important. And that's why I'm so in love with it, is that it keeps you well balanced. So if you're not using it, you are going to be off balance and you're more prone to injury, obviously.
Welcome to Breath, the new science of a lost start expert Q&A. This is the special Prague edition because that's where I am. Joining us today is Dr. Belisa Vranich. She is a clinical psychologist and leading expert in the biomechanics of, breathing. She's also the author of the books Breathe and Breathing for Warriors, both of which I've learned a lot from over the years and highly recommend. So Dr. Vranich has been kind enough to come here to answer questions not from me, but from you all. And here we go. The first one is from Rick S, and it is, how can you measure your biomechanics of breathing?
Oh, Rick S, thank you for asking that. You need to go to thebreathingiq.com. And pretty much what we're going to look at is something that's not particularly new, but it is exciting to me, is your thoracic excursion. So how much your chest wall expands and also the location of your breath. So the Breathing IQ looks at those two things, location and range of movement, and gives you a grade. The nice thing about it, unlike your IQ, your regular IQ, is that you can change it and you can make it much better. You can get to an A. And of course, that is the beginning of a good breath, is good mechanics. And from there, strengthen your muscles.
Can you tell me just a couple things we might want to do when we're practicing to try to go from a D- to an A?
The most important thing to do in changing your score is making sure that your rib cage moves. So your intercostals, specifically at the bottom of your rib cage. Sometimes you might have a good diaphragm, a strong diaphragm, big lungs, but your intercostals, if they're tight, they're keeping you from moving your rib cage and expanding to take a big breath. So making sure that those little rib muscles, your intercostals, internal and external, are both strong and stretchy is important. And that's about taking a lateral breath on the inhale and feeling that stretch between your ribs.
Next question from 9 Breathings. What is the connection between body position and breathing?
9. So let's look at sitting. Sitting has absolutely messed up our breathing. It's a posture where it's not conducive to an expansive breath. So for instance, depending on the way that you're sitting, depending on any position that you're in, you should be able to breathe 360 degrees all the way around. So if you're in a yoga posture, jujitsu posture, where part of your body's collapsed, you should be able to breathe through the other side, or what's called behind the shield, through your back. Unfortunately, nowadays, we are auxiliary muscle driven breathers, so we don't have that flexibility anymore. So posture and breathing are definitely linked, and that's why it's important to have a good flexible breath so that you can breathe in all postures.
Next question from Shirley Gukowski. She says, sitting is the new smoking. How can mechanics of breathing be improved while sitting working, not just posture, please?
Oh, Ms. Gukowski, thank you for that question. So if you have to sit, move your hips. So I'm trying to get folks, when I'm teaching them, to change this cue to one where your hips move back and forth. And that's actually much better for your spine and your digestive system. But if you have to sit, make sure that on the inhale, you're taking an anterior pelvic tilt. And that pretty much is selfie butt. It's when your butt's in back of you and your body's sort of forwards. And on the exhale, you're tucking your pelvis underneath you. So it's sort of a seated cat-cow. That's the best thing you can do for your breath to keep it low when you have to sit for extended amounts of time.
Can you also do that breathing technique while you're standing?
Yes, absolutely. And people don't have to notice that you're doing it. Often I have folks say, well, I don't want to take this expansive breath. It makes me look fat on the inhale, but you don't have to do it in an exaggerated way. You can just do it on an inhale. You tip your hips a little bit. You let your middle expand a little bit. And then on the exhale, you rock back and you squeeze your abs and your ribs. And this actually is a very good core exercise as well.
Next question from JC O'Brien Books wants to know, how do you rebalance your breathing after an injury to your core?
Oh, great question, JC. So rebalancing your breath after an injury to your core. And actually, injury to your core is one of the main reasons our breath changes. We start bracing, an emotional corset, muscular corset, but also guarding because you had an injury is one of the reasons the breath goes from being one that's diaphragmatic to being one that's apical or vertical. So making sure that you're not guarding anymore. And this ends up being subconscious. You know, I'm a psychologist, so I always bring in the psychology of breath into what I do as well, is that often we end up bracing and guarding way after that injury has healed. So just check yourself throughout the day that you're not guarding that part of your body. Rib injuries are one of the most common injuries that take the breath and make it mechanically unsound. And they're also extremely painful. So keeping that guarding way after you need to is something that you're probably doing. You have to catch yourself and see if you can stretch and move that part of your body. I mean, it may be a little uncomfortable. Obviously, don't go to pain, but being conscious of it, stretching it, and making sure that your breath is wide on the bottom and then narrows on the exhale. Great question.
You mentioned something that I just thought was interesting called the emotional corset. I've heard you say that before. Do you want to unpack that a little bit?
Sure. So we brace in response to stress. And this bracing happens very, very early in life. I've found that it happens around the age 5 to 6. And 5 to 6 is when you go to school, you start sitting, you start getting tested, because remember in kindergarten, you're not getting tested. You start being more of a social animal. And this is when stress starts happening in the world and you start bracing your little body. So that emotional corset, you can see in adults decades later, is that they're still bracing their bodies in response to stress that started maybe at age 5 and has continued. And now we have, it's not just being tested in our social selves, it's our world, it's our homes, it's our relationships, and squeezing in the middle helps us feel prepared to move, but it's just not a good place to be all the time.
Next question from Mary Lucy Bell. Can you talk about the breath helping incontinence?
Oh, absolutely. Mary Lucy Bell, you have my favorite name so far in this Q&A. So breathing and incontinence. Your thoracic diaphragm and your pelvic diaphragm are connected. They're best friends, I say. On the inhale, your diaphragm flattens out and it pushes your rib cage open. And what happens underneath it is all the organs slightly go down and your pelvic diaphragm should soften. And on the exhale, the opposite happens. There you go. So this is what should be happening. Obviously, it's not that, it's much more subtle, but when your pelvic diaphragm is actually exercised with every breath, your pelvic health is going to be much better. So making sure that on the inhale, you are relaxing your pelvic floor, your bicycle seat. And on the exhale, you might want to give it a squeeze as you squeeze your abs as well, is going to help everything that has to do with your pelvic floor health. And obviously seeing a pelvic floor physical therapist, specifically a pelvic floor physical therapist, is very important.
From Joanne 3880 wants to know, why is it so important to specifically train the breathing muscles for non-athletes and athletes alike?
Well, training your breathing muscles is not only going to help your performance, and all that has wonderful research that has come out of the UK and Australia. But we have a lot of research that shows, in addition to a book by Alison McConnell, Breathe Better, Perform Better, is that working out your breathing muscles helps delay fatigue. But also we are in a respiratory health crisis right now. So being able to have a breath that ventilates well with muscles that are strong, and having a good exhale, a good cough, that you're able to cough frequently and in a productive way. If you're sick, whether that's COVID or Delta or bronchitis or pneumonia or just your average cold, is terrifically important. So those muscles need to be strong in order for you to continue to have that productive cough and that exhale that is strong.
From Upside Down Rada, can you talk about how the diaphragm plays a role in stability, meaning that a weak diaphragm could impact low back pain?
Absolutely. And there is good research that shows that knee and ankle injury often go hand in hand with vertical breathing. And FMS actually did a study as well that looked at movement and breathing and how they go together. So breathing well and moving well is terrifically important, and it's hard to do one without the other. So the diaphragm is not only your main muscle of respiration, it's also your main muscle of balance. So a lot of folks don't know that. It has this very important, it has more than a dual role because it affects your digestion as well. But that's why it's so important, and that's why I'm so in love with it, is that it keeps you well balanced. So if you're not using it, you are going to be off balance and you're more prone to injury, obviously. So if you'd like an expert that has to do with balance and diaphragm, Mary Massery is the absolute queen of this. Go ahead and look her up. She's far more intelligent than I am in this topic, but that's the first step.
The next question, I doubt that, by the way. Moving on. The next question by J. Lubin Webb Koza. I'm sure I screwed that up, but that's what it is. How to breathe while cycling and running to make it optimal in lowering your heart rate.
Fantastic. So cycling and running. There's really interesting research on muscles that you use for both exercise and breathing, and why it's important to exercise your breathing muscles, because you could experience fatigue in the movements you need for your sport because your breathing muscles aren't strong. So I can give you an article on that if you want to put it in your show notes. When you are breathing, when you are cycling, you're going to be taking more of a back and side breath. When you're swimming or running, the breath changes as well. When you're running, depending on how much you have to brace your body. So for instance, if you are running on a downhill, you're going to have to brace more, which means your breath is not as expansive. But going from a back breath on a bicycle to running, let's say on flat terrain, you have to slightly cue yourself to remember that you can now take a breath that's circumferential. When you're running, you can actually relax your core if you're on flat ground. And when you go to your bicycle, you're going to actually think about, as you do in rowing, opening up the back of your body when you cycle.
Next question from Tanya Spark. I've heard a lot of questions about breathing in my years. I'm sure you have too, but I've never heard this one. So without further ado, it is this: a large amount of singers also suffer from acid reflux. Is there a relationship between the deep mouth breathing we do when singing? Nose breathing is too slow for singers. And when you're singing every day, I wonder about its effects. Our lungs are strong, but does the stomach and sinus take a beating?
So my thought on this is that because on the exhale, your diaphragm is relaxing, your esophagus might be more open than with your average person. So on the inhale, your diaphragm flattens, and it also helps your esophagus squeeze. There's a sphincter there that goes right through your diaphragm, but that's only on the inhale. So think about what singers do. They actually exhale, control the breath audibly to be able to create sound. But what's happening there is that that opening is relaxing with the exhale. So my thought is that it's probably open more than your average person would. And that's what's creating the acid reflux. But that's a fantastic question, though.
And a fantastic answer, I might add. So the next question by Theodore Lapanis wants to know, this is a bit long, so would love to hear your thoughts on the role, if any, of the asymmetry of the diaphragm and how it plays in breathing dysfunction, specifically the ideas of Ron Ruska at the Postural Restoration Institute, especially since Vranich referenced Ron's illustrations in her book. There it is.
PRI and Ron Hruska are brilliant. They really, talking about the diaphragm and explaining to people that we are not symmetrical on the inside. So we think that we hope we're symmetrical on the outside, and then we think that the inside is the same, and it's not true. Your diaphragm is thicker on the right side. It's stronger on the right side because you have 3 lobes there, and you also have the liver underneath, and it's spending a lot of time trying to help the liver do what it's supposed to do. And on the left side, it's a little bit thinner and there's more space because you have 2 lobes and your heart, and you don't have organs that are as dense. So the diaphragm is asymmetrical. I've had people take classes with me, and then the ones that have very good sense of their bodies come back and say, I feel different on the left and on the right. My body moves more on the left than it does on the right. Is that normal? Am I okay? So there is a certain amount of difference that there should be in the movement on either side. However, PRI and Ryan Hruska really go into when there is too much. And that has to do with spine health and all kinds of things that they're very much experts of. But the main answer is that yes, we are very much different on the inside. Our diaphragm is different right to left. And actually the front of it and the back of it as well are very, very different. And just knowing that and feeling that and having that awareness of the diaphragm being asymmetrical is important in understanding your breathing, for sure.
I'm just going to pipe in just for a second here. I know I promised I wouldn't, but I lied. So what I had heard from Dr. Andrew Weil when I was talking to him months back is he asked me, what causes scoliosis? So we've known about scoliosis forever. What causes it? We still don't know. What Weil had heard, at least this is according to him, not me, is that scoliosis could be caused possibly by some sort of breathing dysfunction early on in life. And when you are quickly developing and you are breathing in a dysfunctional way, it could contribute to the curvature of the spine. I want to be very clear, this has not been scientifically vetted. There have been no experiments, but I just thought it was an interesting hypothesis.
I haven't heard of it. However, I love the idea, and I love Andrew Weil, of course. But what I do know is that if you do not address your breath when you're looking at scoliosis, you're missing out. So for instance, if you have scoliosis and you continue to breathe the way, you're sort of supporting the curvature rather than changing it. So you have to look at how you're breathing and actually use props to help your back move or not continue to have more curvature when you're using your breath. Otherwise, the muscles and the pattern of breath will actually support that curvature, which is what you don't want to do. So I love that idea. That makes sense to me.
Next question from Vicky Dustin. Wants to know, what about aggressive energetic breathing techniques? Are you concerned about oversympathetic responses? Because I live in the yoga world and it can happen. And I'm wondering about all the non-professionals teaching this rigorous breath work.
Great question again. And I so appreciate that question, is that you need to teach breath work in an ethical way. And joining organizations that promote the ethics of breath work is very important. Doing huge groups where you don't have a support system for people that are there, or you're not monitoring people's responses is unethical, really. I'm not saying you can't do big groups, but I'm saying that you need to make sure that you take care of people who might have a more extreme response to vigorous breath work. So you have to do more than just ask, do you get panic attacks? Or are you, do you have trauma? Because often folks that are coming to class would not self-report that they are fragile. And also, as a teacher, you need to be able to differentiate when someone is having a cathartic moment or when they're having a psychotic break. And that's a very, very important distinction, which if you're not trained and you haven't spoken to people who have seen this before and know how to deal with it, can be both upsetting for the person going through it, the people around you, and the teacher themselves. So doing things carefully, making sure if you're a new breathwork teacher that you have supervision and you have people to talk to, and making sure that you have a support system for your clients is terrifically important.
Last question today. It is from Erica Idell. If you could give people one simple exercise to do every day, what would it be?
One simple exercise to do every day is expand the middle of your body without using your shoulders. So I'm going to stress without using your shoulders, because when you say take a deep breath, most people will lift their shoulders and actually sometimes even narrow their middles. So thinking that the breath is an inhale and it's expansive, and remembering that word expand in the middle, like a balloon, like any animal on the planet. And then on the exhale, narrow, and pay attention to your exhale, because it is the underdog. And it's something that we think that there's this recoil that's passive. If you're breathing with auxiliary muscles, your exhale is not going to be a natural recoil. That only happens when you're taking a horizontal diaphragmatic breath. So pay attention to your exhale, make sure you're narrowing, and on the inhale, let yourself expand all the way around.
Well, it's unanimous over here. You just passed your PhD dissertation in breathing mechanics, with flying colors, I might add. So where can people learn more about you and your work?
Thebreathingclass.com. I should say my Instagram, I think it's Dr. Belisa. Dr. Belisa. The Breathing IQ is where you can get your breathing IQ and get sent exercises. And yeah, and that's about it.
Thank you so much, Dr. Belisa. Breathe well, and until we talk again, take care. Bye-bye.